And the Delhi government is prepared to deal with the Omicron variant of the coronavirus. Chief Minister Kejriwal said after a meeting to discuss the new variant threat, even as he urged the public not to panic, saying that even though the variant was said to spread faster than previous ones, its symptoms are mild. The national capital has reported 24 cases of the Omicron variant so far. Of these 24 patients, 12 have been discharged. That's what the government says. The Chief Minister Kejriwal, however, appealed to the centre to provide booster doses to ensure that people are protected against this new variant. He says that we will first give the booster dose to health workers and then to all residents of Delhi.
तो एक तो एक्सपर्ट्स ने ये बताया कि ओमिक्रॉन फैलता बहुत तेजी से है, बहुत ज़्यादा तेजी से फैलता है, लेकिन इसके सिम्टम्स बहुत माइल्ड हैं। सबसे पहले मैं दिल्ली के सभी लोगों को ये कहना चाहता हूँ कि घबराने की बिल्कुल ज़रूरत नहीं है, पैनिक करने की बिल्कुल ज़रूरत नहीं है। पहली चीज़ तो जैसा मैंने कहा कि एक्सपर्ट्स कह रहे हैं बहुत माइल्ड है, लेकिन अगर आपको अस्पतालों की ज़रूरत भी पड़ेगी, दवाइयों की ज़रूरत भी पड़ेगी, तो दिल्ली सरकार ने सारे इंतज़ाम किए हुए हैं। दूसरा आज एक इम्पॉर्टेंट निर्णय ये लिया गया कि अभी जितने भी केसेस, कुछ दिन से केसेस बढ़ने लगे हैं, जैसे पहले रोज आ रहे थे 15 केसेस, 20 केसेस, लेकिन कल 100 के पार कर गए, 100 से ज़्यादा केसेस आए हैं। ये केसेस कौन से हैं? क्या ये ओमिक्रॉन है या ये पुराने वाला वायरस है, नए वाला वायरस है? अभी तक केवल एयरपोर्ट पे जो लोग आ रहे थे उनकी हम टेस्टिंग कर रहे थे। अब हमने ये तय किया है कि सारे जितने भी पॉजिटिव केस दिल्ली के अंदर निकलेंगे सबको हम जीनोम टेस्टिंग के लिए भेजेंगे।
The bigger concern was also the rise in the number of cases in the national capital, because yesterday there were 107 cases. That was highest in like 6 months. Before that it was also one of the highest cases in approximately 3 to 4 months. That was 86 cases, and before that we have seen 85 cases 3 days back. So one thing is very clear, that the number of cases are rising, but to determine that what exactly is the factor that is behind this uptick in the number of cases, we have to ramp up a genomic sequencing, because the numbers of genomic sequencing and the ratio has been extremely low when we compare it to other nations, especially the Western countries, which have been doing a lot of genomic sequencing to find out the variant that is dominating. For example, now in London, it is the Omicron variant that is dominating, and to find out that what exactly is happening as far as the Omicron spread in the national capital, this decision has been made to conduct genomic sequencing of all of these tests that are turning out to be positive of COVID patients. Now, another important aspect that the Chief Minister raised today in the press conference was a booster dose, because most of our healthcare workers received their jabs in the beginning of the vaccination drive, and the waning immunity from these two doses have been proved by many, has been spoken about by many experts. So yes, there is a need to start the booster doses, but it remains to be seen that whether the central government will be giving a nod for that, because it has been made clear that any decision on booster doses will only be made after proper scientific evidence. Now, a lot of experts are asking for booster doses for healthcare workers, frontline workers, and it remains to be seen that what exactly is central government's decision on that. But one thing, apart from these two decisions, these two calls that have been given by the Chief Minister, is a strict adherence of COVID-appropriate behavior, because in this festive season we have seen mass gatherings at areas like markets and several gatherings because of festivals, and that can also be a contributing factor to this uptick in the number of cases. And in the upcoming days as well, since the holidays are going to start, there will be Christmas, there will be New Year, so uptake is also expected because of celebrations of these festivals. So to find out that what exactly is the reason, whether Omicron is here in the national capital and without any close contacts or travel history, that is going to be a huge concern, and to establish that only a genomic sequencing is the way.